Thank you for joining me today. Today we are going to go over medication called Sudromadrol. Sudromadrol is medication for inflammation. So Sudromadrol, also called methylprednisolone, it's used for inflammation and ammonia suppression effect across many systems. So mostly the people I see it used being prescribed it to are people who have pneumonia. So this medication indication include allergic reaction, inflammation of some conditions. These conditions include severe allergic reaction. It includes asthma exacerbation. It also used for autoimmune or disorders like like the rhythm or lupus. Also, I have been seen used for arthritis, psoriasis. So it is also being used the acute exacerbation of multiple sclerosis. Dermatology, I have been seen used for severe eczema, Steven-Johnson syndrome, psoriasis, as we mentioned. GI, I have been seen used for ulcerative colitis. It's also acute flares of Crohn disease. Endocrine, I seen being used the adrenal insufficiency, and this medication is glucocorticoid. It's glucocorticoid, and that is the class called systemic corticosteroid. It's called Sudromadrol. Other name is Methylprednisolone. So we will go over that medication, and some of the side effects include increased appetite and weight gain, fluid retention, and edema. Those are the common side effects. It's also mood changes. It leads to anxiety, irritability, insomnia. It elevates the blood glucose and blood pressure. Those are some of the side effects. Long-term and serious side effects of this medication include adrenal suppression, fraction of the bone. It destroys the bone, it makes the bone weaker. It leads to osteoporosis. It also leads to GI bleeding, peptic ulcer disease, increases the infection risk. It increases glaucoma and cataracts. It also leads to psychiatric effects, include manic psychosis. So are some of the side effects to watch for when you prescribe or taking this medication. What to monitor? You will monitor the vital signs, include the blood pressure, weight, edema. You will check the blood sugar, especially diabetic patients. You will also monitor the electrolytes like sodium and potassium. You will check the CBC for infection risks. You will also assess the bone mineral density with prolonged use. You will screen for glaucoma with chronic usage of this medication, may lead glaucoma or cataracts. You will also monitor a sign of infection like fever, sore throat, delay wound healing. Patient education. The key patient education include counseling points should be include. Do not stop this medication abruptly. This medication has to be taper. It's required to prevent adrenal crisis. So it leads, if you stop the medication quickly, it leads adrenal crisis. Take with food or milk to reduce the GI upset. You will avoid live vaccination while on in a immunosuppression doses, because this medication lower the inflammation, depress the immune system. That's why it leads to infection. That's why it leads susceptibility of an infection. Don't lead to infection, but it will make your immune system weak. You will be weak to infection. You will also you will tell the patient to report a sign of infection. Black stools if they are bleeding, if they have a GI bleed, if they seen their stool is black, they should report that. If they feel fever, sore throat, and they feel they are infected, they should report that to the provider. If they see, you will educate the patient. If they feel visual changes, they should come and report that or have an appointment with their primary care. Mood and behavior change, if they see that on themselves, they should come back. Diabetic patients should monitor blood sugar more frequently. I have seen people who are not diabetic, but when they take this medication, they should be also check their blood sugar, because this increases their blood sugar level. So clinical takeaways are always taper after a long-term therapy to avoid adrenal suppression. use a short-term course, and still require adherence to schedule. So you will schedule, you will still require, they cannot stop quickly, so they have to come and have a schedule. Has a minimum mineralocorticoid activities. This is the mineralocorticoid, so not ideal alone for adrenal replacement. Can mask infection symptoms, like a fever may be absent. Long-term use, consider a calcium plus vitamin D supplement because it will weaken your bone. Stress dosing may be needed during the surgery or illness or trauma. Okay, so surammatrol is one of those medications. I have a story based on surammatrol, and surammatrol is one of those medications that announce itself not quietly but subtle. So I first thought of it for Mr. D. Mr. D is one of the patients that was taking this medication that I met. He is 40, she is a 48 years old woman. She was admitted for severe asthma exacerbation. She had already failed repeated NAP treatment, so she had been taking NAP treatment before, and then she had surammatrol being considered. In the emergency, her work of breathing was obvious in the moment she walked into the room. So she was hyperventilating, it was hard for her to breathe. She has a short of breath, fear was on her face. Oxygen helped but not enough. When she came to the emergency, oxygen was given, but it was not enough for her. This was not the time for restraint. Let us start IV of surammatrol. That's what I say. This was not about the symptoms relief alone. It was about interrupting the inflammation fast enough to change the course. So this medication is the reason you consider to interrupt the inflammation fast enough to change the course of the disease. Within an hour, her breathing improved. Chest tighten easing because her chest was tightening. She was breathing heavily, so you can tell she's breathing easy. Peak float jumped. Steroids, when they work, remain you why they are foundation in acute in a acute care. So this medication is used for acute care, not long-term care. As we mentioned, it has a long-term effects if you use it long-term. But the next day, the other side of a suromatrol arrived. So she feel better, but there is a other side to suromatrol. She had not slept. So as we mentioned, it causes insomnia. She was jittery, fearful, unusual, irritable. Her blood sugar previously was normal and was now clearly elevated. So it elevated her blood sugar, it make her insomnia. So the side effect is coming to her, even though she feel better to breathe and her inflammation is subsiding and her breath is improving. One eye round, she said quietly, I feel like my thought is one step down. Nothing had gone wrong. This was simply a systemic corticosteroids doing exactly what they do. We walked, we talked honestly. I explained that the suromatrol does not choose a single organ system. It touches everything. Her lungs, it affected her lungs, ammonia system, metabolism, mood. We reframe the experience. This agitation was not anxiety returning, and it was not her failing treatment. It was the medication working broadly. So this medication is a broad systemic corticosteroid doing exactly what they do. They affect every system, the lungs, ammonia system, GI, mood. So, as her respiratory status improved, we transition thoughtfully IV to oral, high dose to tupper, not abruptly, not careless. I wrote explicit instruction for the tapering, lowering down. Knowing first hand how stopping steroid can backfire. By discharge, she was calmer, sleeping again. Her breath became comfortable. She thanked me not just for helping her breathe, but for winning her before the side effects felt scary or inexplicable. Then reinforced something suromatrol teaches repeatedly. Steroid does not whisper, they broadcast. And part of the good prescribing is helping the patient understand the noise. You will help the patient to understand what is happening, why they feel in this way, what kind of side effect did they watch for, how do they going to feel, how they going to deal with that. So Rheumatoid is not something you just give. It is something you use deliberately and anticipate fully and win carefully. You win off carefully. So my question to you is, when starting Rheumatoid, how do you prepare the patient and the care team for systemic effects like mood changes, hyperglycemia, sleep disturbance, even when the medication is clearly life-saving? So this medication is a life-saving medication, but it has a serious side effects like mood changes, hyperglycemia, that increase your blood sugar level. It will, some people that I seen, they say they have nightmares, they have sleep disturbance. So thank you joining me today. I will love to see you in my next video. Thank you.